So, Holly, thank you so much for being here.
Thank you for having me.
I would love to start with knowing what got you into this idea and this interest in trauma, especially the intersection with sex toys.
How I got into the field is related to how I came up with this research project. So, when I was in undergraduate, in order to have two jobs, in undergraduate, I used to also work in retail. And in order to have another job, I had to have a job that was open overnight. So I started moonlighting at the adult toy store.
Okay.
And additionally, and that's what I call like my first taste of couples therapy. And additionally, I started volunteering at my local rape crisis center. And so I would actually show up to the hospital when folks reported sexual assaults and were getting their rape kits just to be an advocate and a support person because many of these people would be showing up alone.
Yeah, yeah.
So with that, I got really interested and kind of pivoted my career into wanting to work with sexual assault survivors. And I noticed there was a lot of support for survivors as far as reducing PTSD symptoms and recovering in that way. But what stood out to me based on what I was seeing and my own personal journey was like, well, when do we get to have fun again? Right. And like the fun stuff I thought of as like my time at the adult toy store, right?
Uh,
When is the fun part and enjoying pleasurable connected sex happen? And so that's kind of what propelled me into being a sex therapist. And also full circle by the time I was working on my PhD, I was like, oh, sex toys were, a big part of my own healing. And
mm,
I wondered if they were a part of other survivors' healing as well.
interesting. Yeah, because you're right. So much of the focus can be on reducing the trauma symptoms, I guess, but not on like reclaiming our own sexuality, right? Which is
Which
where
is so important.
yeah, yeah. So, for people that might not have thought about this, I mean, some listeners obviously will have had this experience, but how is it that sexual trauma can affect somebody's connection to their own sexuality and pleasure?
hmm Yeah. So a lot of different ways. In some ways, it can make survivors feel completely cut off or disconnected from their own bodies. It can cause them to start internalizing these beliefs about sex. Unfortunately, for a lot of the participants in my study, most of them, their first sexual experience was an experience of sexual violence.
Yeah.
And so it kind of combines those two experiences in their brain to believing that like sex is dangerous or sex is not for my own pleasure, it's for the other person's pleasure. And even if it's not your first experience, we kind of hear these statements or these scripts about sex in general. Additionally, survivors might use sex as a way, they might engage in what we call like hypersexuality, right? By almost having like a false sense of control
Mm,
by like, oh, I'm going to choose to have more sex or engage in sex in this way because that way it feels like I'm in control. And those are some of the main ways that I see survivors struggling with sex and intimacy, on top of like, just fear and distrust in people because a lot of their experiences of sexual violence are people that we know, we trusted, and
mm,
that took advantage of us.
yeah. So, talk a little bit specifically about sex toys then as a vehicle towards healing and reclaiming this part of ourselves.
Mhm. So when I first thought about this, I think about sex toys as like a symbol, right? It's an object that has power in that it's battery operated or it's rechargeable or can plug in, right? And
Okay,
so I
like
thought of
literal power, right?
like literal power, right? Like
Yeah.
electricity. And so I thought about it as like a symbol of like reclaiming, like putting power into your own hands, right? Which kind of
Mm,
symbolizes that reclamation of the power is in my hands because what we know about sexual violence is it's really about power and control, not just about sex.
right.
And then as I did these interviews, what I found as a clinician myself is that a lot of the ways that survivors were describing their use with sex toys aligned with therapeutic modalities that we use as therapists, right? So one of which was challenging or re-scripting those narratives or negative beliefs about sex, right? We call it re-scripting maladaptive schemas, right? Which is something that we do in those cognitive therapies like CBT or CPT or schema therapy. And so survivors said, I went from thinking that sex is dangerous or sex is for someone else to the sex toy helped me see that sex can feel good or it can be on my own terms.
Mm.
So that was one way. Another way is it really aligned with exposure therapy. People talked about it being as a way to get close to the thing that they were scared of in small, safe baby steps. And
So,
one person, yeah.
well, I was going to say, so when you were talking to people, they came across this on their own. They discovered this sort of exposure or rewriting scripts or
Mhm.
taking power back into their own hands. Like a lot of people came to this on their own.
Hmm. And they wouldn't use clinical terms, right? I
Right,
mean,
right.
but
But
but saying like the exposure therapy, right? Like one participant said, it's like baby steps, and you get to get close to that thing you're scared of, which is
yeah,
essentially what exposure therapy is. And then would describe, first I would use a sex toy alone, and then I would use a sex toy in one room while my partner was in another room, and then I worked up to him being in the same room, and then we worked up to having sex together. And so it's really that like ladder approach that we see
right,
in exposure therapy.
right. And how important is it, like sex toys specifically beyond just masturbation?
That's a good question. So some I think masturbation has shown to be really helpful in terms of empowerment with or without sex toys.
Hmm.
And that was something else that came up in my research was how it helped people to feel empowered through helping them feel competent about their bodies and increasing self-esteem, increasing confidence and interpersonal assertiveness, right? Is how I looked at empowerment. So with a sex toy versus without, for some people, it felt more comfortable to use an object as opposed to using their own hands.
Hmm.
Although I, as a clinician, am like, I try and urge people to being too reliant on one particular way, right? Like, I
Yeah,
think it's
right, right.
important to connect with the body in that way. But either way, both with or without a sex toy, we've seen that research shows that masturbation to be a really helpful way of be feeling empowered and connected to one's body.
Yeah, yeah. And given, I mean, this still comes up in my practice. Sometimes there's still a stigma about using sex toys. Like it's
Hmm.
either like I shouldn't need this or it's dirty in some like sleazy adult store kind of thing. I mean, like sometimes
Hmm.
people still struggle with the concept. Is that, I mean, I don't know if your participants, these survivors, this was all retrospective, they'd already done this, or is this something that you
Hmm.
have to work with people to overcome that stigma? Or what kind of myths do we have to take apart about this?
Yeah, that's a good question. Well, for the participants, they had already done this, right? Like, in order to participate, you had to have used a sex toy after experiencing sexual violence. So they had already done this, but some of them talked about even that shame and working up to get to the place where they could use a sex toy. Maybe they went with a friend to a store, so they felt like they had somebody to support them. But what I really hope is that through this research, and there are other studies that talk about benefits of sex toys, whether it be physical or psychological or even relational benefits of sex toys. And so my hope is that with research like this, it helps to reduce the shame and stigma by showing the value of sex toys beyond just novelty and pleasure is valuable enough in itself.
Right, right.
But also kind of adding this as more of like a tool, like it provides like real clinical, psychological, relational value.
Yeah. So, can you talk a little bit about how you did the research and some of the stories you heard? And I don't know, what surprised you the most?
Yeah. So all of the stories were, I mean, it's terrible and unfortunate that so many women have to go through this. My participants were women, but of course we know
Okay.
that this happens to all different folks.
Right.
What surprised me the most was how much it aligned with different therapeutic practices.
Yeah.
Something that were interesting that came up is that most survivors used things that were non-phallic. like toys that look like other things. Like someone described, oh, I have one that looks like a cucumber or like an eggplant or a rubber ducky, right? They've and I think that adds to the comfort level, especially if they were assaulted by somebody with a penis, to have
Yeah.
something that was non-phallic and allow them to connect with their body in that way. That was something that stood out to me.
Yeah.
Um, and the last thing that stood out that I thought was kind of funny but interesting, is I did ask people if they ever felt triggered or re-traumatized or anything negative
Mm-hmm.
associated with their use of sex toys. And the most common response was when the sex toy dies.
Wow.
And
Okay.
um, which is funny, right? Most people said that in jest, but I think it also kind of brings up this ambivalence, and we can think about, especially as clinicians, if we were to like consider somebody using a sex toy or like suggest that, I think it kind of brings up this ambivalence and made me think about, well, what does that mean if, again, going back to the idea of like actual like electric power, if this thing dies, right? Does
Mm.
that reinforce this loss of control?
Mm.
And so just something to consider as we're thinking about the use of sex toys in trauma recovery.
Yeah. So, in with your participants, I don't know what else you were asking besides about their use of sex toys, but like, where did that fit in a maybe larger context of healing? Like, it was just a certain part of the journey. Did it go throughout the whole thing? What else were they doing? Like,
Good
do you have some more
question.
context for how people are incorporating that?
Yeah, good question. So this study was particularly about the use of sex toys. It was very like an open-ended interview style study. So people were able to share different things. I also asked questions about therapy, right? Had they been to therapy? Had they not been to therapy? Some shared that they did, some shared that they didn't. I
Mm-hmm.
asked about if folks felt comfortable if their therapist asked them about using sex toys or talked to them about sex toys.
Yeah.
And the overwhelming response was as long as there was good rapport, then absolutely.
Yeah. Yeah. For the participants, and again, I don't know if this came up in your study, but for the participants that were partnered,
Mm-hmm.
how was their partner's reaction to using the sex toy alone, using that as a tool of healing? Was it
Mm-hmm.
generally, I mean, was there mixed messages about that, or what did you hear?
Yeah, mixed messages. So that was one question I asked in particular was, how has your experience with sex toys been individually versus in partnership? And so for some, unfortunately, like the partner's reaction, if their partner had a negative reaction to the sex toys, it might have like reinforced this belief that like something was wrong with them for
Yeah.
using this tool. But for others, for many of them, it was a positive experience with their partner and again, allowed them to I think feel safe in that their partner is open to exploring and isn't shaming them about this thing. And we know that
Yeah.
safety is so important for the healing of survivors.
Right. Right. Well, yeah. Also, that they support whatever the partner needs to heal, and that their pleasure matters and their comfort matters. Right. That all
Mhm.
seems crucial.
Mhm.
So, has this research shaped now how you're working with clients? I mean, because did you learn anything that shifted how you're talking to survivors or how you're working with people, or did you pretty much have the same approach? And this just confirmed?
It's a similar approach. I think it provides me with more comfort in like asking about these things. I think there's something about that we have to be careful with as far as like the ethics around like prescribing a sex toy as a clinician. So that's still not something I necessarily do. In particular, myself, I don't want to, everybody's body is so different. So I never want to be like, oh, like this one's great. Here, try this one. And someone has a terrible experience. And now it's like, oh my gosh, Holly recommended this thing and it was so uncomfortable or like it
Yeah,
didn't feel good, right? Um, More so I'll just say like here are some things you might want to try if you're interested, but I think it reinforces like the importance of asking about pleasure in the aftermath of trauma. Like what are they doing for pleasure, whether that's masturbation, whether that's with or without the use of a sex toy or other things.
right. Or with or without a partner. Yeah.
Mhm.
Do you see that part of the healing is sort of stage two, that stage one is, crisis and PTSD and trauma and like that needs to be completed to a certain degree? Or do you think these can overlap? Maybe
Yeah,
it's an individual case by case situation, but
yeah, I think it's certainly a case by case situation. I think pleasure can certainly be healing. Um, but if somebody is triggered by the thought of anything that has to do with sex, right? Or anything that has to do with their genitals. Like, of course, we want to kind of triage and make sure that they're not having panic attacks and nightmares and things like that. But I certainly think that there can be some overlap depending on the person. And I kind of heard that in the participant reports too, that maybe they didn't feel like they were fully healed, whatever that means, right?
right.
Until they started incorporating a sex toy.
Yeah. All right. So, for anybody who's listening who is a survivor, who's had trauma and has maybe, I don't know, not considered this before, not done it, what would be your guidance, some gentle steps, some ways to think about this? I guess your invitation to people to consider.
Yeah. I would invite folks to consider pleasure as a part of their healing, whether that's with a sex toy or with something else, like a pleasurable bubble bath, even, right? It doesn't have to be something as, um, it doesn't have to be a sex toy, right?
Right.
If they are considering using a sex toy, I would encourage them to just be thoughtful and intentional and listen to their bodies. And if you need to stop, you can stop. If you don't want to try this, don't like their healing is within their control. And so I really want to drive home that it's really up to them how they choose to heal. And this is just another option or another tool in the tool belt.
Yeah. And it is another chance to like take your power, right? Like
Mhm.
tune into your body and how is this for you and what choice do you want to make about it?
Absolutely.
Do you think, I mean, what do you recommend in terms of shopping for one, especially for Survivor? Is the adult
Yeah.
toy store? I mean, I know that my own experience in some of these, the staff are incredibly well trained and supportive
hmm
and, like really professional. Other ones probably
hmm
less so. But like,
hmm
what do you advise for a Survivor? Is it shop online and have it arrive in a brown box or go consult professionals?
Yeah, I mean, I think it's whatever the person feels comfortable with, right? If you feel more comfortable shopping online, do your due diligence, right? Check it out, see what it's made out of. We want to make sure that we're using things that are body safe and we can actually use on and in our bodies. if it's some if someone feels comfortable going in person, I definitely encourage that, especially you're going into a place where the folks working there see people shopping for this stuff all the time. So it's
Mm-hmm.
really not a place to feel shame. And like you said, there are a lot of places in which the folks working there are very well trained. They know a lot about the products. They get to try the products, right? And this is, I used to work in adult retail too. So this is like part of my own
Right, right.
experience. And so I would certainly check, like look up reviews online of even the stores, right? I know like Good Vibrations is great. Carol Queen's done a really wonderful job of like setting that up. And there are some other, feminist shops in which you might feel more comfortable because they're set up from a feminist lens and it can be really, really supportive. So it's really, again, goes back to what you feel comfortable with and looking at what options you have.
Yeah. Yeah. Anything I forgot to ask you about your research or the takeaways on this?
I don't think so. I think we
Okay.
covered the whole thing. It went a lot quicker than my actual PhD process.
Right, I bet. Yeah. That probably was a long time. So
Yes.
so where do people find you? How do they reach out? What do
Yeah,
you what do you have you want to mention to folks?
absolutely. So they can find me at thehollywoodsexologist.com. That's where all of my therapy services, they can access all of the information that I share. And if they want to hear something more like what you're sharing, I offer free evidence-based information on sex, relationships, and mental health every week on YouTube at The Hollywood Sexologist.
Perfect. Thank you so much.
Thank you.